Good evening, everyone. We begin with breaking developments right now on the Ebola crisis, the disease closer to Ohio than ever before.
We now know that second health worker with Ebola was on a Frontier's airline flight from Cleveland to Dallas just days ago. And before boarding that flight, she reportedly had a temperature of 99.5. Doctors we called said they do consider that a low-grade fever.
Right now, the CDC is notifying all passengers on board that flight. They will determine if anyone needs monitoring. 9 on Your Side has a crew on their way to Cleveland right now to follow how state officials are monitoring this situation.
Here's what we know right now. The second healthcare worker, Amber Vinson, flew into Cleveland Hopkins International Airport October 10th to visit family in Akron. She left on the 13th. The CDC says she reported to the Dallas hospital where she worked with a low-grade fever and was put in isolation the very next day. This scare putting many Ohioans on edge and Cleveland leaders taking an abundance of caution.
Now, it's important to note at this point, to the best of our knowledge, we have not had any cases of Ebola in the city of Cleveland. Just the same, this is a very important public health issue, and it is important that we all stay focused on the facts and sharing information.
132 passengers were on board that flight, flight number 1143 on Monday night. All are being asked to contact the CDC. If you were on that flight, you can call 1-800-CDC-INFO. We checked with CVG to make sure this flight did not pass through Cincinnati. There were no connections here in the tri-state.
Just a short time ago, Governor Kasich released a statement on the Ebola scare. It states, "I have been fully briefed on the federal, state, and local activities that are underway and have directed state health officials to aggressively respond to the situation and provide local health officials every resource and support they need." Governor John Kasich went on to say the risk to people who have had no direct contact with the nurse remains very low, but everyone is seeking to apply the lessons from Dallas, and we are responding aggressively to this situation.
As the governor said, the risk is very low. Just moments ago, we spoke with a tri-state health official about the risks as well from a healthcare perspective.
It's unlikely that folks here are going to contract Ebola. We're much more likely to contract a variety of other infectious diseases that are much more common, like the cold and the flu and those kinds of things.
Dr. Sadler adds that Ebola is spread through direct contact from a patient exhibiting symptoms. Direct contact means blood or body fluids, which then have to get inside your body. Examples include kissing or sharing food with someone. A great practice is to wash hands and keep them away from your face.